Hi, my name is Dr. Monica Nowak. If you're watching this video today, you or someone that you care about is suffering with a thyroid disorder. My partner, Dr. Peter Markowitz, and I have been chiropractors since 2003 and have been in private practice in Canaan, Connecticut since 2009. We have done extensive postgraduate studies in nutrition, blood chemistry, endocrinology, thyroid disorders, brain and neurotransmitters, and a variety of neurology classes. Now we will talk about thyroid disorders. First of all, let's talk about what it means to have a thyroid disorder. Most people, a vast majority of people, are going to be suffering with hypothyroid type symptoms. Hypothyroid type symptoms can most often include extreme fatigue and an inability to lose weight, even with a good diet and exercise. Those two symptoms right there are probably the two biggest reasons to drive women to go to the doctor to be checked for something like hypothyroidism. Additionally, you may be suffering with constipation, have problem eating fatty foods because of gallbladder issues, have blood sugar regulation problems. With that, cold hands and feet, hair falling out in clumps, eyebrows that are thinning in the outer third, depression, and brain fog. Additionally, many are going to be suffering with hypertype symptoms, and those can include heart palpitations, these are the most common, anxiety, not being able to sleep at night, and inward trembling. Normally what we see in the office is really a little bit of both, hyper and hypo, meaning most patients present with symptoms from both categories. When we see that, the differential diagnosis is whether the patient has Hashimoto's thyroidism, which is an autoimmune thyroid problem. By the time you get here to our office, you have probably been to see other doctors, which have probably run some sort of panels on you already. I have to tell you, from a medical standpoint, which is sometimes driven by the insurance company, the panels that you get run are really not comprehensive enough. They don't encompass enough testing to give you all the information that we need to make a viable diagnosis and an efficient treatment plan. Additionally, the lab ranges that they use are so broad that your disease process has to be fairly progressed in order for it to show up on the labs. So, speaking of incomplete lab testing that is done, what we see most often done is TSH and T4 is run. These alone are just not enough to figure out what is wrong. The system is way more complex than these markers can fetter through. In our office, we run minimally a TSH, a T4, a T3, a T3 uptake, and always run the antibodies. Why? Because a vast majority, definitively over 50% and closer to 90% of people who suffer with hypothyroidism also suffer with Hashimoto's. They have an autoimmune problem and not as much a thyroid problem. So in order for us to ascertain that, we have to run a complete thyroid panel, which is normally not even done. Secondly, when the panel is run, the TSH lab values that they use are just too broad. This is how normal lab ranges are ascertained. Let's say 100 people go to the lab. They get the same test done, and at the end of the year, the lab takes the results from these 100 people. They hack off the 10 lowest scores, they hack off the 10 highest scores, and everything in the middle is considered normal range. Well, everybody knows that a vast majority of people going to get blood work done are sick people. They are people that have cancer, are getting chemo treatments, have numerous other illnesses or disorders. To use that average of sick people as your goal of what is okay or normal is a bad idea. So what we use or look at is from a functional range. A functional range is going to be much narrower, and because of that, we're going to catch things before the system is totally out of whack and or so far advanced that there is permanent damage or change that cannot be reversed. For example, on a TSH, normal TSH lab values are probably 0.45 to 4.5. The functional ranges that we use are 1.8 to 3. Where do we get those numbers from? The Endocrinology Society. And those ranges are based on where does that range need to fall for your body to do everything that it's supposed to be doing so that it is functioning at 100%, which is where you want to be, right? You don't want your functional well-being to be based on sick people. You want your functional well-being to be based on the average of healthy people. So the two problems that we have, number one, people have incomplete testing done. They may only have a couple markers run, and you can't figure out what's going on by doing that. 2, people have the right test done, but they're based on the wrong functional averages. The doctor will tell you, you don't have a problem, you're within normal range. But you're thinking, then why am I still having these crazy symptoms? This is what we typically see with lab testing. Okay, so there are also active and inactive hormones that the thyroid makes. And I'm going to give you a little bit of the physiology of the thyroid because you need to have enough knowledge to know how the thyroid works and how it dysfunctions. Suffice to say, we're not going to make an endocrinologist out of you in 5 minutes. But here's the basic thyroid physiology. The hypothalamus tells the pituitary to tell the thyroid to make thyroid hormones. The thyroid makes 2 hormones, T4 and T3. T4 is the inactive hormone, and T3 is the active thyroid hormone, one that actually activates the cells. So the vast majority of the thyroid hormone made is T4, 93%. Only 7% of the thyroid hormone that is made is T3, the active form. In order for your body to utilize the thyroid hormone, it has to be converted. That conversion process happens in 3 different areas in the body. Number 1, it happens in the liver. About 60%. A vast majority gets converted in the liver. 20% gets converted in the gut. And 20% gets converted in the periphery tissue in the body. Starting with T3 production in the liver, let me ask you this. If you have a liver issue, whether it's cirrhosis, hepatitis, maybe you take a variety of medications that negatively impact your liver, maybe you have a gallbladder that's backed up, any number of these things can create a problem in the liver, impairing the function of the liver, jeopardizing the conversion of T4 to T3. This means starting right there, you're not going to have enough active hormones to activate the cells. That's number 1, the liver. Number 2, the conversion that takes place in the gut. It has to be balanced in terms of flora for the overall health of the gut. It has to function properly in order for that 20% of T4 to be converted to T3. Anything and any number of things can create a problem here. The number 1 causing problems is food sensitivities. They cause inflammation, which can disrupt the gut. You can have bacterial, parasitic, and or yeast infections in the gut. All of these symptoms will negatively impact the gut function. We'll also look at the periphery, what normally happens here, which is especially common in the US, is there's too much cortisol in your systems. Cortisol is a stress hormone, and when you live in the US, you are usually overbooked, way too busy, and not getting enough rest. If cortisol is too high in the periphery, you will not get the proper T4 to T3 conversion. Now, the only way to know this is happening is to run a full panel of the thyroid. You are not going to see that by running a TSH and a T4. Some of the other tests that we run are a variety of metabolic and neurologic tests. We leave no stone unturned. We are going to be looking at the physiologic or metabolic viewpoint, your blood chemistry and the way your blood works, and the neurologic viewpoint. What that means is, how is the brain and the nervous system working, and how is it contributing to the problems you have? So from a metabolic or physiologic standpoint, we are going to run a variety of tests. We run a complete thyroid panel, lipid panel, which includes cholesterol, triglycerides, HDL, and LDL. We are going to look at the function of the kidneys and the liver. Your blood work is going to be looked at under a microscope. We also look at inflammatory markers. Those are important for a number of reasons, because inflammation will decrease the conversion of T4 to T3, and in addition, it'll just make you feel bad. We will look at homocysteine. Homocysteine is the most indicative marker for cardiovascular disease, and I've never seen it run on any lab panel. We will also look at HRP and fibrinogen. Fibrinogen has to do with clotting. So when all 3 of these values are high, they are contributing factors to an increased risk of cardiovascular disease. These are things we want you to be aware of. Additionally, we will run an adrenal panel. Why? For a couple reasons. Adrenal glands are a couple of glands that sit on top of your kidneys. They are stress glands. If you are someone that suffers with insomnia, which is right across the board, everyone, we will be looking at your adrenals. The adrenal glands are responsible for making things like cortisol and other hormones. That is why it is important to look at the adrenals. We will also be addressing food sensitivities. If you have a problem with a type of food that you are eating on a regular basis, you could be making your problem worse. We will be looking at gluten. We haven't seen a thyroid patient that hasn't tested positive for gluten sensitivity. Casein, which is dairy, soy, eggs, and yeast. We will be looking at all 5 of these to determine whether or not you are allergic to them, to any of them, or all of them. If necessary, we will eliminate them from your diet. We will eliminate it and the problem that they are causing you. The next test, which is extremely important, is the gut pathology test. What that does is it looks at DNA PCR testing for gut pathologies. What I mean by this is we're testing for bacteria, for yeast, and parasites, which are extremely common. They are way more common than you may think here in the US. This is an invaluable test that we run on everyone. It is important to fix these problems before we address others. Additionally, we will run an intestinal permeability test. If your gut is leaking, you're going to be reacting to everything that goes into your body. Your body will form a reaction to the food that you're ingesting, creating inflammation and wreaking havoc. Intestinal permeability also does not allow you to absorb the nutrients from the food that you are eating, and that is not good. Hormone panels are run on most patients, especially women, because when components of the endocrine system or the thyroid are not working properly, it's going to affect everything in the endocrine system. Female hormones are part of this system. When you have a hormone disruption or a disorder, you can have anything from heavy, horrible periods to PMS to mood swings. If you're menopausal, you could be having hot flashes, you may be growing facial hair, and or a host of other problems that are unpleasant and unnecessary. There are also specific dietary and metabolic issues that we address here in the office. What this depends on is running the test, looking at what's going on with you personally, and designing the nutritional and metabolic intervention based on what you need personally and individually. If there are foods that we need to eliminate, we eliminate them. We make sure that you are eating what you're supposed to, when you're supposed to, and how you're supposed to. We are going to make other changes in your lifestyle. Some of you may need to go to the gym. Some of you may be going to the gym for 3 hours a day, which could be counterproductive to you getting well. We are going to make sure that you are sleeping enough and well. So these things really speak to the metabolic side of things, because in my experience, the metabolic system is the driver of the neurologic system, although they both are really important. The neurologic system is the brain and nervous system. The brain needs 2 things to do its job successfully. Every day, fuel and activation. The fuel that the brain uses is glucose, or sugar as you may know it, and oxygen. So if you don't have enough of either, then the brain doesn't have the fuel that it needs to work. So again, from a metabolic perspective, you have a blood sugar regulation problem. And what I mean by this is you have diabetes or hypoglycemia, etc. You are not going to have good blood sugar going to the brain, and the brain is not going to have the fuel that it needs on a regular basis to function. Additionally, if you have something like anemia, which is very common, your brain is not going to get the oxygen that it so desperately needs. What I want you to remember and really understand is your treatment is totally indicated by your testing, and that's the way you get better. We leave no stone unturned. We look at your health from a metabolic standpoint with all the testing that we have just described. We look at your health from a neurologic standpoint with all the other testing that we've described. So once we get all that information we need, we can pinpoint where the problem or problems are and fix them most appropriately. That is why we are successful. So if what I've said here maybe struck a nerve with you, great, I'm glad. I'm glad we can pass along some information to you. I want you to realize that this type of problem that you have, a thyroid disorder, is not going to get better if you don't take care of it properly. It will continue to get worse, and you will continue to get worse. I am sure that for those of you that have had a thyroid disorder for any length of time, if you look back to when you first were diagnosed or started to not feel well, you have probably noticed a progression of the illness, a downward spiral. So I want you to think about, if you don't do anything other than what you've been doing, which is really not working for you, where are you going to be in 1 to 3 years? How is it going to negatively impact your family, your work, your relationships with other people? So call us today. Come in and fill out our intake forms. Sign up for our thyroid workshop. Get informed and let us help you. Dr. Monica Nowak leaving you. Thank you for listening, and we look forward to seeing you and meeting you in our office.